Mr. Chair, I want to briefly now go through a snapshot of the scale of the crisis in the eastern region. Ambulance response times in the east of England are significantly worse than the rest of England. In 2023, response times for Category 1, those are severe cases, was nearly 12 minutes in East Anglia. The national target is 7 minutes. This was nearly the worst on record. The Care Quality Commission itself, now under inquiry and investigation for its own capabilities to do its job, has described Norwich University Hospital as the worst in the east of England for ambulance times. Referrals to mental health services increased by 18% between 2018 and 2020. Compared to the rest of England, Norwich and Norfolk have higher rates of self-harm, death by suicide, or mental health issues among young people and more self-diagnosed mental health issues generally. Our mental health trust, the Norfolk and Suffolk Foundation Trust, is notorious for being the worst in the country. I will say that again. Our mental health trust in the east of England is notorious for being the worst in the country. Norwich is a dental desert. In July, the now Secretary of State branded Norwich North the Sahara of dental deserts. A rather romantic notion, but a desert where people pull their own teeth out in a burgeoning phenomenon of a DIY, do-it-yourself dentistry industry. Indeed, some of my Ukrainian constituents have told me that they find it preferable to dodge Russian missiles and artillery to use Ukrainian dentists, which arguably has a better dental system in the middle of a prolonged war. Unsurprising, given that in the East we have one NHS dentist, no, it's not even an NHS dentist, it's one dentist per 2,600 people. And just picture that in your head, if you will. One dentist with their tools waiting for 2,600 people queued up. I think that's what it feels like to many of my constituents.